Welcome to Horizons Radio, a broadcast of the Battle Creek Community Foundation, heard every Monday at 5 p.m. on WFPM 99.5 in Battle Creek, 99.9 in Albion, and 103.7 in Jackson, Michigan. You may also tune in through the internet, in your car, or while at work. However you are joining us, thank you for being with us today. My name is Lynn Ward Gray, Development Officer for the Battle Creek Community Foundation and your host for Horizons Radio. At the Battle Creek Community Foundation, we envision a vibrant, healthy, and viable Battle Creek and partner with individuals, families, and organizations to make this vision a reality. We help donors explore their philanthropic passion and connect that passion to nonprofit organizations that are making a real difference in our community. Today, it is my pleasure to welcome for the first time to Horizons Radio, Dr. Will Nettleton and Betty Moorehead, as we discuss the COVID-19 vaccine distribution. Dr. Nettleton is an assistant professor of family and community medicine at Western Michigan University Homer Stryker MD School of Medicine. He is also the medical director for not only Calhoun County Public Health Department, but the medical director for Kalamazoo County Health and Community Services Department. And he's a hometown son who returned home to his local community. We love that. Betty Moorehead, I have personal stories about Betty Moorehead that go way, way back because she raised me practically. But it's been a joy to get to know her in my adult life as a community member and a member of the Battle Creek NAACP, amongst a whole lot of other things. She has actually received both doses of the vaccine at a local clinic, and so she will be speaking with us today from that perspective. Welcome to you both.
Thank you.
You're welcome. You're welcome. Now, when we have new guests on the show, I ask them to share their journey to their current positions in case someone in our listening audience has an interest, and to give folks a window into who they are and what inspirations, circumstances, and or passions have led them to their current career or volunteerism. So there's a catch though. You have to do it in 2 minutes or less. Yes, I know it's hard, but we've got some great information to get to. So Betty, I'm going to start with you and then I'll go to Dr. Nettleton.
Okay. Thank you, Lynn. I have lived in the Battle Creek community most of my life. I retired from the Kellogg Company 20 years ago. Kellogg's encouraged all its employees to volunteer in the community, and that carried on into my retirement. And I've been actively involved and sat on several boards. I enjoy people and I enjoy connecting, and I just want to be an example, a good example to our community members.
And that you are. Thank you so much, Betty, for being with us today. Dr. Nettleton.
Thank you for having me. So my background is that I'm a family physician, but I also serve as a public health physician. So I did a dual residency program in family medicine and also preventive medicine and public health out in Portland, Oregon. So I really desired to be able to take care of individuals and families throughout their entire life. That's why I wanted to become a family doctor. But I also, early in just personal disposition and early in training, realized that I was interested in taking care of our entire community. And that's a different type of training, a different perspective, and that's preventive medicine and public health. And so that's why I pursued that training as well. So in the clinic, I take care of patients who and teach medical students and medical residents who see patients in a federally qualified health center in Kalamazoo. I also take care of hospitalized patients as well, and have cared for patients who are suffering from COVID-19 in the hospital. But for the past year, I've been really in the front line of our local public health response as part of the COVID-19 pandemic. And I'd be very happy to talk about it. But after my training, I did, as you pointed out, Ms. Gray, chose to come home to Battle Creek in Kalamazoo. I'm very happy to be here.
That is outstanding, and we're happy to have you back home. So today we are talking about a very, very timely topic, focusing on the COVID-19 vaccine distribution. And our shows, of course, are connected to the Battle Creek Community Foundation in some way. So today we highlight the Population Health Alliance of Calhoun County, which is a fund of the Battle Creek Community Foundation, and the Alliance formed a vaccine education work group. And so the goal of that campaign was to educate Calhoun County communities about the COVID-19 vaccine and to reduce the fear and misinformation surrounding it. What we hope to do here today is address some of the distrust many people of color have for the medical community by providing relatable, important information about the COVID-19 vaccine, and encourage people to seek out more information where we hope they will find the vaccine is one of the many ways to keep themselves and others they care about safe as we work towards a time when getting together, being social with one another, is safe again with the virus far, far, far behind us. Let's begin our conversation with vaccine safety. Dr. Nettleton, if you could explain the mRNA vaccine, both the Pfizer and the Moderna vaccine.
Sure. So mRNA stands for messenger RNA. So, what does that mean? So you could think about this as the mRNA is the code to produce proteins or antibodies that protect you if you were ever exposed to the virus that causes COVID-19. So how does that work? You can imagine this code is surrounded by a fat layer. So when you get the vaccine, that shot in the arm, the vaccine is uptaken by your cell and it stays in the jelly of the cell. It does not alter your DNA. It just helps your cell produce those proteins or antibodies that helps protect you against the virus that causes COVID-19. And that's true for both the Pfizer and the Moderna vaccines. Both are mRNA vaccines.
Perfect. So safety, that's another concern that's out there, safety of the vaccines. Explaining can you explain the level of the clinical trials that have happened, the development and the whole process there, so people just get an understanding there?
Yeah, I often hear gosh, doc, this seemed to be developed really fast. How was that possible? So way back in, January of 2020, when we first kind of learned about the virus, the scientists uploaded the genetic code online for scientists all over the world to see, which really gave scientists a leg up as opposed to, for example, using a live virus, which takes a little bit of a longer time to use and develop in a laboratory. So that way the scientists could hit the ground running with the clinical trials very quickly with the mRNA vaccine. And so they enrolled and they started these phases of clinical trials. And that includes both safety and also effectiveness of the vaccine. And there are 3 phases typically of a clinical trial. The first phase is about safety. The second phase is both safety and effectiveness. And the third phase is, again, looking at how effective it is at preventing severe disease, in this case, or hospitalization. So it was not rushed. It was just expedited on a timeline, given that we had a leg up about the genetic sequence of the virus. And the clinical trials for both the Pfizer and the Moderna vaccines concluded that this is a highly safe and effective vaccine. And both trials included tens of thousands of people. And both trials included approximately 9 or 10%, depending on the trial, of those who are Black or African American as participants in the clinical trials. Both the effectiveness was around 94, 95%, which is really high. So again, these are safe and effective vaccines.
Wow. So that's good to know. It just, as you were talking about that, I was thinking, is there great place to go look at the information about the trial so people can, if they want to dig deeper into that, that they could see it?
There are several good sources. One is the Centers for Disease Control and Prevention. The other is the Michigan Department of Health and Human Services. But the agency that provides the oversight of clinical trials is the FDA, the Food and Drug Administration. And they provide what's known as an emergency use authorization, which is very detailed. And so if you like to look at all the details, that's the place to go, is the FDA. And you can look up it's called the EUA. But I think the CDC is probably more patient friendly in terms of being able to digest kind of all of that scientific data.
I like those words, patient friendly. Yes. So I just wanted to also add, there's a lot of conversations around 1 dose, 2 dose. I know the Johnson & Johnson vaccine is now being discussed for emergency authorization. Can you just kind of touch on the importance of, getting the dose as prescribed by these different offerings?
Yes, excellent question. And so both the Pfizer and the Moderna vaccines have been studied with 2 doses. So for the Pfizer vaccine, the 2 doses is separated by a minimum of 21 days. For the Moderna vaccine, the minimum time period between the first and second dose is 28 days. So you can think about this as priming the pump. So the reason for getting the second dose is that first one was getting your body like, okay, this is what the COVID-19 kind of protein kind of looks like. So if you're ever exposed to it, you kind of know what you do. The second dose is boosting your immune system and priming your pump to be extra ready if you're ever exposed to the virus.
You have really good analogies. I love that. Thank you. So there's some myths around the vaccine. One is that it'll make you really, really sick. Kind of talk about those myths for a minute.
Sure. So it is common to have what we call side effects or adverse effects. And when I received my vaccine, for example, I had a pretty sore arm. And I also had a moderate headache the next day. Other folks may experience kind of some muscle pain, and generally some folks have a mild fever or kind of run down. So that is your body telling you that it is priming the pump, getting ready, and it's your immune response. It's really what your body is doing, is getting ready for your immune system if you're ever exposed to fight off the virus. And so it's really your body's response, an immune response. The COVID-19 vaccine cannot give you COVID-19. Those symptoms instead are really your body's immune response.
That is a really good point. I'm glad you said that the vaccine cannot give you COVID-19. That is so important. And the fact that those slight symptoms are really a sign that it's working. And that's a good thing, that is doing what it needs to do.
And so those side effects are more common in younger people, because they have a more robust immune system, and it's typically more common after the second dose. And I've also had patients mention that for those who've actually had COVID-19 and then got the COVID-19 vaccine later, anecdotally, I've had those patients say, boy, I really did feel the effects of the vaccine. And that makes sense to me, because their body has already kind of been exposed to the virus, and now they're getting the vaccine. They're saying, your body is saying, oh, I know what that is, and its pump is already primed.
Wow. Well, that you just went right into my next question so wonderfully, because that's a question. The people who have had COVID-19, should they get the vaccine? What do you say about that?
The answer is yes, for a couple of reasons. So one, the clinical trials really only followed people for 2 months. And we as scientists, believe that your body's protection will last longer than that. But we also like to make decisions based on evidence, which is based on studies. So officially, we don't know how long your immunity lasts if you were to have COVID-19 disease or infection. We're also still learning for how long the vaccine provides you protection as well. So that's the reason why we still want people to have who've had COVID-19 to get the vaccine. Now, having said that, we do recommend that you wait you can have the option of waiting 90 days after your end of your infection of COVID-19 before you get the vaccine. That's not to say you can't receive it sooner than that. It's more that we think you probably have some protection from getting infected again for about 3 months after being infected. And that gives opportunity for someone else who may be more vulnerable to receive the vaccine at this time.
Wow, that's fascinating. I'm wondering, so if you are getting the vaccine, you've explained some of the symptoms that you might experience, and for sure mention any additional that might be out there. But how do you report a bad reaction after getting the vaccine? Because I know there's a certain amount of time that you're there in the presence of someone. I think it's 15 minutes, correct me if I'm wrong. And then what happens if you have a bad reaction later on?
Yes, and so you've heard about us talk about today about those common side effects after the vaccine, but you may have also heard about those very, very rare reactions that people may get after a vaccine or exposed to any other type of what we call allergen, which is known as anaphylaxis, or that severe allergic reaction to the ingredients in the vaccine. And that's known as anaphylaxis. And so to your point, we watch all people who receive the vaccine for about 15 minutes after they receive the vaccine to make sure everything's going okay. For those who have a history of anaphylaxis or severe allergic reaction to anything in the past, we watch those folks for 30 minutes. So that's part of your vaccine plan when you go to your doctor or the local public health department. You can expect to be registered. You can expect to answer a medical screening questionnaire. You will receive the vaccine in your arm, and you'll receive a COVID-19 card to say what day and time you got vaccinated, and also at that time to make your second dose appointment as well, which is also very important. Now, to your primary question, how do you report vaccine reactions? If you have a smartphone, you can actually register with something that's called vSafe with the CDC, and you'll receive that information when you go for vaccination. Completely voluntary. But if you're interested, it can give you prompts to when you get your second vaccine. But if you have those reactions, those common reactions or a severe reaction, you can report those to the CDC as well. That's called vSafe. You can find that on the Centers for Disease Control and Prevention's website. And then for all vaccines, even besides COVID-19, doctors and public health departments are required to report severe reactions to vaccines through something called VAERS, the Vaccine Adverse Reporting System.
So much good information. This always happens. We have about 11 minutes left. We're going to get it all in. Oh, the marathon begins. So, are there any pros or cons about the vaccine? I mean, some people are thinking, if I'm really elderly, I don't know if I should get it, those kind of things. Talk about any pros or cons.
Yeah, I think about it in terms of risk and benefit rather than pros and cons. So elderly population, we know that our elders are at high risk for severe complications of hospitalization and death. That's why we are prioritizing seniors 65 and older to get vaccinated. So really the benefit of receiving the vaccine in that population far outweighs any risk associated with it. Really, the main only medical contraindication or medical reason not to receive the vaccine is if you have a severe allergic reaction, known severe allergic reaction to any of the ingredients in the vaccine. And that's very, very rare. Now, there are several precautions. For example, if you are pregnant or breastfeeding, we talk more about that in detail. You may receive the vaccine if you are pregnant or breastfeeding. And it's thinking about your risks and benefits, for example. For example, if you're a doctor or someone who works with people face-to-face or a nurse and around a lot of people, and you have a high prevalence of COVID-19 in your community, your risk of COVID-19 is high. And when you're thinking about pregnancy or breastfeeding, those folks actually weren't included in the clinical trials. But overall, we know for COVID-19 that those who are pregnant do suffer at a higher rate of complication. So that's another thing to consider as well, and talk with your doctor about as well, whether you make that decision to receive the COVID-19 vaccine if you are pregnant. For those who are breastfeeding, there is no medical reason to suggest that the mRNA vaccine affects breastfeeding, affects the mom, or affects the baby. The mRNA lasts very shortly in the body. My wife happens to be breastfeeding. If she were eligible to receive the vaccine, I would recommend it to her. But that's another conversation to have with your physician, for example. So I think about it in terms of that risk and benefit, and particularly for those who are older, those with underlying medical conditions, you're at high risk for complications for COVID-19, and the benefit of the vaccine far outweighs the risk in my assessment.
Oh my gosh, excellent information. Thank you so much for being on Horizons Radio, getting so much out of this. I hope our listening audience is as well. So let's get to the distribution part of our conversation, and then we'll bring in Betty in a moment. When will the vaccine be available more widely? Because I know that is on the minds of a lot of community members.
That's the million-dollar question, isn't it?
It is.
Also a source of,
Sorry to put you on the spot like that.
Yeah, for many people in our community, but also for us who are administering vaccine, we're frustrated too. And so this is really on the federal level. And so, but just to give a timeline, I think things will be opening up in the spring with those additional doses being purchased by the federal government, and with the advent of the Johnson & Johnson vaccine, which should go before the FDA over the weekend. But in terms of kind of where we're in phase 1B in Michigan and Calhoun County. So we're vaccinating the seniors. We've already vaccinated our healthcare professionals. We hope to be vaccinating those who are in daycares, those who are frontline responders, and then moving towards those who work in food, for example, groceries, agriculture, and other frontline workers. And that phase 1B is probably going to be lasting through March and April or so, before we move to what we know as phase 1C, which includes those who are 18 to 64 with underlying medical conditions. But phase 1B is a big bucket. It's a lot of folks who are serving our community. And just for perspective, for those who are 65 years and older in Calhoun County, that's 25,000 people. And so we're still working through those populations.
Wow, that's a lot. I was going to ask that question, like how many are in that 65 and older, which are now being vaccinated. As this airs, that's who's being vaccinated right now. What stage of distribution is the health department in? So you said it was at 1B. Is that the
correct
technical term for it?
Yes.
Okay, and that's the 65 and over. 65
and older, but also folks like teachers we're vaccinating right now, folks who are going to be in agriculture, grocery stores, and other essential frontline workers.
Ah, okay, all right. And I know that those mass clinics are taking place. The Y Center has hosted several of those. And there's also some mini clinics going on, kind of trying to address what this alliance is trying to address, the disparities in distribution in the communities of color, particularly African American. So I know the NAACP is involved in trying to get the word out about those. And those are really meant to be word of mouth, neighborhood focus, and those kinds of things. You want to say anything additional about those?
Absolutely. In addition to doing kind of those mass vaccination clinics, we want to go where people are at. And we want to make decisions based on those who suffer disproportionately, those who suffer from severe disease based on age, but also those who historically have been marginalized and historically have distrusted the public health and medical community for good reason. And so, as you mentioned, we've been partnering with our community organizations, including the NAACP, and we're actually holding our first church event tomorrow morning, and we're very excited for these partnerships moving forward.
That is perfect. Thank you so much for talking about that. And speaking of the NAACP, we're going to bring in Betty to talk a little bit about her experiences in getting the vaccine, both the first and the second. So Betty, I'm going to unmute you and ask you to unmute, and then we will proceed with your comments about the vaccine. Go right ahead. We can hear you.
All right. Well, my experience was really a positive experience. I had answered some questions, and one of those were, why was it comfortable to me? And I think listening to Dr. Nettleton, I had done the right thing. I had done my homework. I called my physician and made sure it was okay with them. And I even talked to my pharmacist about my medication list. And after that, I decided it was the best thing to do for all the reasons, in the right reasons, like he said, the risks and benefits, and to protect myself, my family, and get back to some sense of normalcy. Did you have any specific questions about the virus, about receiving the virus?
Are there any side effects that you feel? We talked a little bit about the side effects. Dr. Nettleton has had the vaccine, and so he's talked about a little bit of his. What from your perspective did you experience?
That's funny. I listened to him say, well, because I'm of age, I had little side effects. I actually had a slight sore arm, and I didn't take anything for it. I was prepared to take medicine for that, like an aspirin, but it wasn't that severe. No headaches. And later, maybe 4 days later, aches and pains. And that's gone away. I've had my second shot 1 week ago today. And I feel and have felt marvelous. No fever, basically no side effects, comparable to getting my flu shot every year.
And I'm going to give you a minute because we're wrapping up here, but could you talk about the importance of people knowing that you got both vaccines and that you're fine? What is the importance of that?
I feel that as a mother and grandmother, and they live here in the community, and I wanted to interact with them. That was first, my family interacting and being around my family. And then second of all, I think is just a sense of commitment to the community I live in, and all my friends and cohorts, the people that I am involved with as I serve as a servant in the community. My church, I worship at Maranatha Church, Original Church of God, and I've been away from church, and I'm anxious to get back to that. So it's just, to me, it's important for my little community and our community as well, as opposed to, the whole state, getting back to some sense of normalcy.
That sums it up right there, to get back to some sense of normalcy. But Dr. Nettleton, I'm going to bring you in 30 seconds. If you could talk about the vaccine is not the only thing. Can you just really talk about that?
Yes, we still need to be wearing our masks, to be socially distancing and washing our hands. And I bet you're saying, well, hold on, Doc, you just said this was a highly effective vaccine. So what's that all about? You could think about this as the Swiss cheese model. We want to use every tool we have in our toolbox to defeat this virus, to plug the holes in the Swiss cheese. And the vaccine is another great way to do that. And we got to think about this not just in terms of ourselves and our families, but the entire population. You don't know who's going to be vaccinated when you're out at the grocery store or out and about. And so we still have to be doing all these things to protect ourselves and our community, and likely well into 2021.
To 2022. We're in 2021. So wait a minute.
Well, into 2021, I think.
Oh, good. I like the way you think.
Well, into 2021.
All right. Great. So we've talked about the importance of getting the vaccine, protecting yourself, people close to you and the community. Betty talked about that wonderfully, reminding you guys to really listen for information. There's a lot of different webinars and different information coming out from your public health department about where we are in the vaccine, what stage we are in the timeline, those kinds of things. Wear your mask, social distance still. That adds to the benefit of that vaccine. And feel comfortable to, certainly speak to your physician about this and get more comfortable with it that way. We are just, having one sense of information here, not all, and we're not telling anybody to go get the vaccine. We want to make sure we put that out there. We're just trying to provide information today. So thank you, Dr. Nettleton and Betty, for being with us today. And thank you for joining us, our listening audience. The Battle Creek Community Foundation, established in 1974, receives its funds from the Battle Creek area citizens and businesses that are committed to making Battle Creek a better place to live. For more information about what we do, what you've heard today, please call us at 269-962-2181 or visit our website at www.bccfoundation.org. Thanks for listening so very much. Appreciate you.
Helping to grow each generation, Battle Creek Community Foundation. Give to your community, we'll help you build a legacy. Start a scholarship, be a volunteer. All your ideas are welcome.